everybody's trying to get into the veins. And today we have a chronically ill patient population. So they're continually coming back to the hospital, thanks to people like you who keep them alive. But their venous vasculature is being depleted. So how do we get access on those people? And that's what I hope to talk to you about today.
Yeah, this is amazing stuff. And this is something that is of great interest to all of you patients out there, because we're all getting stuck. And I do a lot of joint injections and a lot of aspiration of swollen parts of the body. And I try to use ultrasound, but you are actually a master of ultrasound when it comes to placing needles and ports in people.
Well, that's where it gets interesting. There were IV teams back in the 1980s, and patients got their IVs and their infusions and their CT scans so that they could start therapy sooner. And then they got dissolved. So the IVs became just anybody's domain. And then the PICC lines, which are an IV for long-term antibiotics or nutrition, became very popular. And then IVs came back into those vascular teams, but they were much smaller. So they're only getting to 5 or 10% of the patient population. And when you say expert, we can get it in 90% of the time, 97% of the time on the first stick.
Yeah.
And not only does that help the patient, but it saves the hospital and the resources and allows you to get quicker care, quicker diagnostics, and quicker therapy.